I'm just going to, I'm just going to share my content. I'm going to turn my video off and then share my slides. Make sure I put the right one up. So Sarah and Alison asked me to do 2 talks, actually. The first one about a sort of overview about the menopause, what it is, what's happening to our bodies, how we can help ourselves. And then the second one, which I believe is on the 2nd of March, to spend more time going into details about hormone replacement therapy and also non-hormonal medication that it's possible to try for menopause things. And then in both talks, I'm hoping there'll be plenty of time for questions. And here we go. So as long as so I'm assuming that you can all see the slides and that they're working okay.
Yep, that's okay, Amanda.
Brilliant. So my talk is as accurate as possible, but obviously I just have to say that it's general advice. I'm not a substitute for seeing your own GP or your healthcare practitioner if you have specific questions that you and personal questions that you want answers to. So why are we talking about the menopause? Well, we're living much longer now. Average life expectancy is 83. So many women can expect to live a third of their lives after the menopause. And of women that are going through the menopause, studies show that 3/4 are having symptoms and about 1/4 are having pretty severe symptoms. And 1/3 of women have long-term symptoms as well. On average, the length of time symptoms can last for is 5 to 7 years, but about 1/3 have symptoms for a much longer period of time. And many people think that they should just put up with it. They fear that they won't be taken seriously by the healthcare professional, or that they might be judged for needing help, or they might hope that their healthcare professional will actually bring up the subject because it might be embarrassing for them, especially if their symptoms affect their sex life or continence problems. And the other thing is that, you know, up till now, menopause hasn't been on the school curriculum, and so there's still many women that are unaware of some of the symptoms of the menopause. So I've put on the end there, if you're interested, there's a campaign called Make Menopause Matter that you may or may not heard of. It's run by a nurse and counsellor called Diane Danzybrink, who set it up to lead the call for mandatory GP education and greater menopause awareness in the workplace, and for menopause to be added to the PHSE curriculum, which it has done, which is great. Okay. So specifically in the workplace, over the last 10 years, there's been more interest in analysing and addressing the issues to do with menopause and the workplace, and it is obviously very important because 70% of women are in work. Now we have to work longer, often working to age 68 plus, and that's there's 3.5 million women over 50 in the UK, and 36% of the workforce are women over 50, and it's even higher in our healthcare profession. It's nearly 1 million women. And this is one particular survey. It's a few years old now, but it's still relevant. From 2011, British Occupational Health Research Foundation. They studied and found that about 44% of women were fine. The menopause didn't impact their work, but 51% found it was somewhat or fairly difficult, and 5% were finding the impact of the menopause on life and work extremely difficult. 42% perceived their job performance was adversely affected, and 17% thought that their manager's perception of their work was negative. And this is an infographic that was made following that research, when they sort of talked to the participants more. The specific things that they picked out, that the symptoms can pose major and embarrassing problems for women, for some women, leaving them feeling less confident and odds with the professional image that they want to portray. Many were unwilling to disclose menopause-related health problems to line managers, particularly line managers who were younger than them or who were male. And up to that point, it was noted that gender-specific health issues, apart from pregnancy, were rarely discussed in the workplace. And they also noted that a quarter of the women in their study had informal caring responsibilities, as well as having to manage work and menopausal symptoms. And they noticed that there was this group of women in late middle age caught between the generations of family members requiring care, sort of older and younger family members requiring care. And yeah, it's still happening. This was a survey last year, a survey of doctors. The BMA say in their write-up that they sent the survey out to all their members. 93% of respondents had experienced menopause symptoms. So I'm assuming that most the people that responded to the survey were having the menopause, and notably 65% of those people had both physical and also mental health symptoms. So there was a significant impact on mental health as well. And 90% of respondents said that these symptoms had impacted their working lives, and 38% in a significant way. 36% have managed to make change to their working lives. Another 38% wanted to make changes but were not able to do so, and only a small number, only 16%, had discussed their menopause symptoms with their manager, and 47% wanted to but didn't feel comfortable doing so. And there's a link at the bottom if you're interested in reading that survey. So I have been asked in the past, is it just humans that have a menopause? Are we the only species? Well, we almost are. There are a few other species, particularly whales. These 4 particular species of whales have a menopause as well. And there's loads of theories about why that is. One of the most popular ones is called the reproductive conflict theory, that mammals that live in groups and share resources, then the older women in the group, if they were going on to have more and more children when they were older, they would become weaker and they wouldn't be as useful to the group as new females coming in from other groups, almost like to sort of increase the size of the gene pool, but also that so the older whales sort of can have a more supportive role to the younger whales. Okay, so just at this point, I'm just trying out something new. So we're going to do a little quiz. So don't worry, you're not going to be put on the spot or anything like that. When we have a look at the answers, we'll just get a view of the general responses. You won't, and nobody will be identified in any way. So if you can scroll up the chat, the meeting chat, a bit, you'll come to at 12:57. There's a link I've put in. There's basically, it's like a blue F. If you can click on that, it should take you to a little quiz with 3 questions on it. In fact, I'll just remind myself of the questions so I can tell you. So it's basically what proportion of women get an osteoporosis related fracture in their life? At what age are our bones the strongest they will ever be? And then question 3 is, what's the leading cause of mortality in UK women? I think what I'm going to do is just put that link in again now. All right, yeah, I'll put it in again then, because somebody said they can't find it. No, all right then. Okay, I'll do that now then. Okay, if I can get to the chat, hang on. So it's just going on now. So it should be in the chat. It'll either work or it doesn't. If it doesn't work, then I don't know why it's not worked. Ah, right. Yes, I see what you mean. So I've just popped it on again. Yeah, somebody said if we joined after 12:57, we can't see the link. Oh, somebody can see it now. That's good. So just a little bit of fun. Right, hopefully. Ah, brilliant. Thank you. Some people have said, yeah, fantastic. So we'll have a look at the results in a bit. Okay, so we're just going to talk about a bit, well, what's going on in our bodies when we go through the menopause. So the blue and pink graph on the left, or the anatomical right, that's a pictorial representation of 1 month looking at the relationship between pituitary, well, hypothalamic and pituitary hormones, FSH and LH, then the growth of the egg follicles in the ovary and the growth of the lining of the womb throughout the cycle. So basically, the pituitary releases FSH, which stimulates the growth of lots of egg follicles in each ovary, and the cells in the egg follicles produce estrogen levels, which rise from days 0 to 14 of the menstrual cycle, and that stimulates the lining of the womb to grow. And then the levels of estrogen raise, and that stimulates a hormone called LH to be released from the pituitary gland, which then stimulates one of the eggs out of one of the egg follicles to be released at what we call ovulation. And then the cells that are left behind change from releasing estrogen to releasing progesterone. And then that ripens the lining of the womb. And this is a cycle when we're not on any hormonal contraception. So if the egg gets fertilized, then a pregnancy might develop. If not, the lining of the womb breaks down because progesterone levels fall, and the whole cycle starts again. So if we just move to the other graph, the green graph, so the top third of that graph shows 6 cycles of the first graph. So you can see sort of cyclical increases of FSH, LH, estrogen and progesterone. Then eventually, so we are all born with so many eggs, about 1 million altogether, roughly. And even by the time we go through puberty and start releasing eggs, about half of all those eggs have just sort of disappeared, basically. So eventually our ovaries start to run out of eggs, so it becomes much harder for the for them to be released every month. So I'm on slide, somebody's asked what slide am I on? I'm on slide what's going on in our bodies. So it's 2 graphs, a blue and pink graph and a green graph. Okay. So the perimenopause is a time when our hormones can be all over the place, basically, which is the middle part of the green graph, which shows a sort of not a cyclical regular change, but hormones sort of all over the place. Sometimes they might be being released regularly, sometimes not at all, and eventually periods will get lighter and lighter and stop altogether, and very, very small amounts of estrogen will be produced, but not as much as before the menopause. Okay, so I'm going to move on. So this process, so the natural menopause happens at around age 45 to 55. 51 is the average age. A menopause that starts, so menopause by then meaning period stopping, under 45 is classed as an early menopause. And then about 1 in 100 women have what's called a premature menopause or premature ovarian failure, where the ovaries stop releasing eggs before the age of 40. And that in a lot of cases, we don't know why that happens. It might be genetic, autoimmune, or it might be to do with treatment, chemotherapy, radiotherapy, or surgery that some people have to have. Okay, so the symptoms that women can get around the time of the menopause and even before the last period. So menopause itself basically means period stopping, but a lot of women get symptoms leading up to the last period stopping, what we call the perimenopause symptoms. So the symptoms are to do with where estrogen receptors are in the body and that they're not being stimulated as much. So hot flushes, night sweats, due to a change in the sensitivity of our brain's temperature regulation zone, sleeplessness, reduced concentration, headaches, low mood. About 10% of women get emotional symptoms like low mood, tearfulness, anxiety, irritability around the time of the menopause, loss of energy and reduced sexual desire. And as we've said before, periods become less frequent and eventually stop. A lot of women aren't aware that the genitourinary symptoms such as urinary frequency, urgency, pain and recurrent urine infections can be related to the lower estrogen levels peri and post menopause. The same with the vaginal symptoms that some women can get, sometimes sort of 5 to 10 years after the menopause, and then they don't necessarily correlate the two together. So vaginal dryness, painful penetration, reduced arousal and orgasm, dry skin and itchiness, aches and pains, muscle aches and pains, joint aches and pains, a lot of women can get. And then there's some other weird symptoms that could be to do with anything, but you know, if they're yeah, so having to pee behind a tree when running is a symptom. Yes, it can be a symptom of the menopause, but yeah, it can be a few other things as well. So other weird and wonderful symptoms are things like sort of a feeling of pressure or tightness in the head and body, parts of the body feeling numb or tingling, loss of feeling in the hands and feet. I mean, I wouldn't always say that they're definitely due to the menopause. Obviously, they might need investigating as well. But you know, if they occur with these other symptoms, then it's something to consider. And it's not just the severity of the symptoms that can be an issue, because all symptoms we have emotions about the symptom and thoughts that go with those emotions that can sort of create a bit of a vicious circle with and affect the severity of how we perceive the symptoms. Some symptoms that aren't to do with the menopause and do need investigating are if people have more frequent periods and irregular bleeding between periods. That's not a menopause symptom. It does need looking into. And the same with sort of lower abdominal pain and bloating. That again, that's something that just needs looking into. It's not a menopause symptom. And then there's long-term effects as well that are sort of going on that we can't necessarily see or perceive. So before the menopause, estrogen protects women against cardiovascular disease. We're all born with nice clear blood vessels, and throughout life plaques can develop, little deposits of cholesterol and other stuff. I can't remember because it was so long ago when I did all that sort of physiology stuff. And then so the arteries narrow, and they can clots can form, which can is the sort of pathophysiology of arterial disease and strokes. As women catch up men after the menopause. And another hidden effects of the menopause is the effect on bone density. We reach our peak bone mass when we're about 25, and then after that our bones, we maintain bone mass throughout adult life if we're healthy, and then bones do start to lose their mineral content after the menopause, and common fractures include the Colles fracture, wrist fracture, spine fractures, and later on, sort of in the 70s and 80s, hip fractures, which I'm sure you know have a significant morbidity, you know, associated with so it's not just physical symptoms. So it is a change. That's why it's called the change. But it can be happening at a busy time of life when there's all sorts of other change going on. So here's a Vitruvian woman trying to be perfect and juggle and balance lots of different roles in her life. But there are benefits. It's not all doom and gloom. You know, a lot of women find, you know, periods can be very painful and very heavy. So no more periods is a great, it can be a great release, more freedom, no pregnancy worries, no premenstrual syndrome. And we have gathered life experience and wisdom. And the fact is, we are all getting older, and in our modern Western culture, there's a real penchant for visual media dominated by youth and beauty. And that's it. So the menopause is a journey of change on which some can fear becoming unattractive, invisible, and undervalued, particularly in our sort of Western cultures dominated by visual media. However, that's not the same in many other cultures, particularly Asian cultures and indigenous populations, where having life experience and wisdom of the elders is revered, and becoming postmenopausal means moving to a place of honor. I like to call it the wise, being the wise older woman. Some people have asked me, do men have a menopause? Well, no, not really. A few do, but not most men. So obviously our dominant hormone is estrogen. Men's dominant hormone is testosterone, and they don't have a menopausal fall of testosterone. Testosterone production carries on and just gradually falls throughout life from about age 20. So about 3% men in their 60s and about 5% of men in their 70s do have low testosterone levels and andropause. You might notice that the symptoms are very similar to the female menopause. And it's not just to do with aging why some men get an andropause, but it can be due. Yes, I'm going to tell you now. Yeah. So the reason why some men get a menopause is partially aging. It might be genetics, but other factors such as being overweight, obesity, and metabolic syndrome, which is to do when sort of pre-diabetes and raised cholesterol levels can all contribute to having an andropause. Okay. So what I'm going to try and do now is just show you the spread of answers from the quiz. Hopefully this works. If I just go to Microsoft Forms. Oh, wow. Thank you. 34 responses. Right. So I'm just going to see if I can share those with you now. Oops, hang on. What have I done? Oops. Oh, I'm going to get there now. Sorry about the slight. Andropause. It's the andropause. So I've just put another link in, and hopefully if you click on that, you should be able to see the responses. So what proportion of women get an osteoporosis related fracture in their life? Right, so most of you put 1 in 10, then 1 in 50, then 1 in 3, then it's actually 1 in 3 get an osteoporosis related fracture in their life, which might surprise some of you. At what age are the bones the strongest they'll ever be? So yeah, so most of you have put 25, few 15. Yeah, so yes, 25 is about the age that our bones will be the strongest they'll ever be, what we call the peak bone mass. And then what's the leading cause of mortality in UK women? Yeah, most of you have put cardiovascular disease. About 6 of you have put dementia, and 1/4 of you have put breast cancer. Well, in actual fact, it used to be cardiovascular disease until about 10 years ago, but it's actually now dementia and Alzheimer's disease is the leading cause of mortality in UK women. And that's probably due to the fact that we're living longer and there's better treatments for cardiovascular disease than there were. But yes, so cardiovascular disease is the second most leading cause of mortality. Right, so I hope that worked and some of you have been able to see the results. Oh dear, somebody said can't find it. Oh, hang on. All right, yes, so somebody's put their thumb up, so I'm hoping that means that you've been able to click on it and have a look. So, oh, brilliant. So I'm just going to give you a few more for the next half of the talk, if I can come out of here. Brilliant. Oh, I'm glad it's worked for some of you at least. So I've got another little quiz now with 3 more questions for the next bit of the talk. Oops, hang on. All right, here we go. Right, so I'll just tell you what the questions are for that. So there's like a bit of a multiple choice. So which of the following statements about sleep hygiene is the odd one out? Which of the foods below has the highest calcium content? And then a question about paced breathing from the diaphragm, which I'm going to tell you a bit about in a minute. Okie dokie. Right, we're doing fine for time, I think. Yeah, so moving on. So how can we help ourselves? Fans and sprays. You get little spritzer sprays, little mini fans you can carry around in your bag and whatever. Cool pillows. I don't know if any of you have heard of something called a chillo, which is you can fill it up with water and you can put it underneath, you can put it inside your pillowcase. That seems to help some people. Then there's some people say that if you use viscose like bamboo bed linen, or if you can afford it, linen bedwear, nightwear, then that can help. So sleep hygiene is about having a good routine at bedtime. So it's things like not drinking coffee after a certain time at night, not eating late at night, not exercising late at night as well, because all of those things can affect sleep. Keeping the bedroom just for sleep and sex, so not doing your homework in there, you know, sort of lying on the bed while you're trying, you know, just before you get off to sleep. And then making sure that you take some time, some me time, some time out for relaxation, which I know it can be difficult when we've got busy lives with work and caring roles, etc., etc. So the website at the bottom, the Women's Health Concern, I think it's a really good website. It's got lots of useful fact sheets on different symptoms to do with the menopause and self-help tips and recommendations. Right, so sort of talking a little bit more about me time. So we spend the first third of our lives sort of like an inward spiral, sort of taking in ideas and gaining knowledge. And then the second third of our lives is like an outward spiral when we're giving our energy to others, such as our families, our dependents, and our work. Whereas the postmenopausal third, many women can feel a need to take time and energy to explore the creative and spiritual parts of themselves, even if they might not have been aware of these parts of themselves before. So diet and exercise are also my wife uses a chili pad sleep system to control her temperature at night. That sounds fascinating. I'd really like to know a bit more about that. When we get to the questions, maybe you can tell us a bit more about that. So looking after ourselves, so diet, so most of you will probably know a bit about this. So your 5 a day, so heart-friendly fats, things like avocados, unsalted nuts, oily fish, rapeseed and sunflower oil. Cutting down on sugar as well can reduce the stress on our pancreas and reduce the chance of the onset of insulin resistance, sort of pre-diabetes. Alcohol, yeah, we know we shouldn't drink more than 14 units and have some alcohol-free days a week. And for our bones, in winter, we're advised to take a vitamin D supplement, and because there's lower sunlight levels. In the summer, we should be able to get our vitamin D if we have 15 minutes of sun exposure, but with obviously with sun cream on, and calcium rich foods. And there's some good charts at the bottom. I've put some links there to the British Dietetic Association. Yeah. Oh right, sad lamp. Yeah, I need to get one of those. Yeah, and the dogs love it as well. Oh right, yes. Actually, I'll let you into a little secret. My doggy's actually in the room here with me at the moment. She was a bit naughty. I kicked her out, gave her some cheese to move somewhere else, but she crept back in just before the talk. So anyway, so where do we get to? So calcium rich foods. So at the bottom, yeah, the British Dietetic Association. That's got some really good fact sheets about different foods and calcium content of foods. And then the Royal Osteoporosis Society website's got lots of information about keeping your bones healthy as well. So exercise, we're all advised to do at least 2.5 hours exercise a week with a mixture of weight bearing and muscle strengthening exercise. And in fact, actually, that last week I had a link from, I think it came from the Workplace Wellbeing department, you know, some links to various things. And actually the NHS website's got some links to some like 10-minute workouts, which I'm trying to do every day and failing so far. But when I do it, it's quite, I think it's quite good because it's only 10 minutes. And because I'm not very good, I go running, but I'm not very good at doing any sort of muscle strengthening exercises, some upper arm strengthening exercises. So that, yeah, so the NHS website is good as well for exercise routines. And obviously we know about not smoking as well. So moving on, so to sort of over-the-counter sort of natural therapies. So in surveys show that 95% of people would try natural therapies before HRT because they think they're safer. However, they're not regulated as much as HRT and other like licensed medications. So at least with HRT, we know the pros and the cons, and just obviously I'm going to go into that in more detail in the talk next month, but the pros very much outweigh the cons for most people, at least until you're 8. Good to do your exercise after you run. Yes, right, I'll have to remember to do that. Thank you. To do exercises after running, yes. So going back to natural therapies, so 95% would try natural therapies before HRT because they think they're safer. But yes, they're not regulated as much as HRT. So we don't know as much about them. And there's 3 that have been shown to have some effect, and they're red clover, soy supplements. So soy supplements, it's things like Menopause. I know that's a brand. Yeah. And I'm taking Menopause at the moment, and actually I think it is doing something. It's as well as all the multivitamins, it's got what we call plant isoflavones, which have estrogen-like properties. So soy is a plant isoflavone, and there's also others. And then black cohosh is a herb which seems to have some estrogenic properties. Yeah, somebody said they tried black cohosh. Yeah, somebody said they tried black cohosh but had horrendous side effects. Yeah, somebody else has asked what were the side effects. Yeah, black cohosh, there has been some reports of a few people having liver problems. So it isn't something I particularly recommend, but there is evidence that it does work. So this logo, oh right, liver issues, yeah. So yes. So this logo THR shows that if you buy a natural therapy that has got this logo on, then you know that it has had some. It's been validated for strength and quality, so it's had some research behind it. And then there are other non-oral alternative therapies that can help with hot flushes and sweats, and these have been shown in randomized trials to do so. So hypnotherapy has been shown to help, particularly there was a study that showed for women that got breast cancer that it helped with their hot flushes and sweats. And also there's some evidence about electroacupuncture and acupuncture. I'm not quite sure what electroacupuncture is, but anyway. So the other thing that has been shown to help people without taking any sort of medications is CBT for flushes, sweats, and sleep problems. So somebody's saying they found acupuncture really helpful. So this diagram, oh, somebody said they put an electric current through the needles and it feels a bit tingly. Yeah, I assumed it was something like that. Yeah, never tried it myself. I've tried ordinary acupuncture, but not electroacupuncture. So this diagram here shows, if you go clockwise round it, it shows a typical sort of negative thought pattern that some people can have when they have a hot flush. So if we start at the top, so feeling hot and sweaty as a hot flush comes on, and then the thoughts that can be associated with that is, oh, everybody's looking at me, they can tell that I'm having a hot flush, I can't cope with this. You know, I must look really silly and I must look really sweaty and I can't cope. And then the emotions that can go along with that are feeling anxious, feeling embarrassed, and feeling out of control. And it might be so bad that some people might leave the room or avoid getting into those situations in the future. So it sort of can limit their life experiencing the symptoms. So some research by some psychologists that's been, there's a book, there's a self-help book, there's even a manual for people who want to run groups, and there's a nice fact sheet on the Women's Health Concern website about CBT, not only for hot flushes but for sleep problems as well. So that some people might find that helpful. So some of the techniques that are taught are, like somebody's put, it was extreme coldness after each flush that affected me more. Yeah, so some people get, as well as going hot, they can go cold as well. They can have like a cold shiver. I've experienced that a few times. Yes, it isn't particularly pleasant. No. So yes, so the self-help guides, they give information about what's going on. They sort of explain the situations, and as we know, knowledge is power, and tells us more about ourselves. And then a breathing technique that you might have heard of called paced breathing. It's used in lots of different relaxation modalities like sort of progressive muscle relaxation and mindfulness meditation. And also in the course it does some training about negative thinking patterns and how to counteract them. So this diagram here, if you go clockwise round it, is a example of a more balanced thought associated with a hot flush. So starting off with a hot flush, feeling hot and sweaty, palpitations, or maybe a bit cold and shivery. And then so the thoughts, more balanced thoughts might be, well, as people have learnt and understand what's going on, then, let's just deal with this flush just now. Just let's try and just let it. Eventually it will pass, and let's just deal with this one flush at a time. And then maybe some paced breathing through the flush until it passes. And then the feelings that can be associated with that are sort of feeling calmer and more relaxed. Takes practice, of course. And self-help books, great. Some people can learn things from a self-help book. I think personally having some group sessions would be fantastic, because the group, the bonding process through the group and sharing experiences can all be really beneficial as well. So I thought, if we've got time, Sarah, am I allowed to do just a few minute little paced breathing? Have we got time?
Of course, I think we can.
Okay, so it's a sort of calm, slow, even breathing from your tummy, your stomach, or diaphragmatic breathing. So the diaphragm is a strong muscle that's located below the lungs and forms a barrier between the lungs and the abdomen. And so breathing more calmly from the abdomen means we get more oxygen and focus the body's attention onto something else and away from the hot flush. So it can reduce those physical sensations and the emotions and the thought intensity of the anxiety that might be related to the flushes. So if you're in a place where you can just have 2 minutes just free from interruptions or phone calls, just sort of, it can be easy when you're first learning this technique to lie on the floor, but you might not be able to do that where you are at the moment. So maybe if you just give your eyes a little rest by adopting a soft focus, or close them if you wish, if you can, and just notice your body resting on the chair. And then just do a little scan of your body from your head down to your toes, just maybe noticing any sensations, any areas of tension or relaxation. Notice any areas of contact between your body and the chair and the floor. And then just maybe put one hand on your chest and one hand on your abdomen, because that will help as you get used to this way of breathing. So then move your focus onto your breathing now. And then just push your stomach out slightly with each in-breath. And then as you breathe out, just feel yourself relaxing, sitting into the chair. And trying to keep the hand on the chest still, and the hand on your abdomen should just rise and fall in line with your breaths. And as the breath is drawn in through your nose or your mouth, passing through across the back of your mouth and throat and being drawn into your stomach. Your mind might wander off while this is happening. That's because the mind is an organ that's designed for thinking, and that's normal. But just be kind to yourself, and as soon as you notice your mind wandering off, just gradually bring it back to noticing the movement of your tummy and a little bit your chest while you breathe in and out. If we had time, we'd do this for 20 minutes or so and do some relaxation as well. But not today, I'm afraid. So what I'd like you to do now is to just slowly begin to become aware of your surroundings. Just stretch your fingers and toes and feet and legs. And slowly open your eyes if they're closed, or just focus your eyes now. Okay. So if you're still awake, we'll just move on to sort of factors in the workplace that can affect symptoms. So the culture, and as we've seen, there's still pockets, there's still areas like maybe I don't like to say this because I know there's one gentleman here, but maybe more male. I'm being gender stereotyping maybe, so shoot me down if you want to. But maybe more sort of macho-y, male-dominated cultures might be, there might still be a few pockets of sexism and ageism around, but I don't think that's true of our services, where I think they're working really hard to change the culture and address all these reproductive health issues. Environment's obviously important as well. If it's hot or inadequate ventilation at the moment because of COVID, with having to wear all the PPE, maybe overcrowding's less of an issue at the moment because of COVID. Stress as well. So particularly apparently formal meetings and with senior colleagues, or having to learn new skills and presentations can particularly affect symptoms. Lack of access to toilet facilities for people with heavy periods can be an issue. Maybe people that are out on driving around on community duty can be particularly an issue. Lack of access to cold water, regular breaks, type of uniforms we're wearing and PPE we've talked about, and shift work, physical work and shift work particularly can be can affect symptoms. And this is all work that's going on now, which is great. It is becoming, certainly in health professions, I think it is becoming more. There's more awareness of the importance of it for the health of your work, of the workforce. So equality and diversity training, including menopause policies, staff wellbeing services, occupational health, and also not only just with support with the physical symptoms, but also the mental health symptoms as well. Allowing flexible working practices where possible, and then all the common sense environmental changes that shouldn't really take too much effort to implement. Right. Oh, so it's 5 to 2. So, I'm quickly going to just show you the responses, put the responses up for the quiz. Brilliant. 32 of you have responded. Just copy that now and pop that in the chat. Okay. And then we'll fire away with questions. Hopefully that's worked. So I'll just quickly go through the answers very quickly. So most of you said yes. So most of you said answering your work emails in bed's not a good idea for sleep hygiene. Yes. Oh, right. This is more interesting. The highest calcium content. So yeah, majority went for yogurt and then sardines, which you'd think, but actually I was tricking you a bit with this question. It's actually a malted milk drink. I was really surprised about that. Also, you've got to be careful about the sugar content with that. And then, yeah, number 3, most of you said, yeah, paced breathing can help with all of those: anxiety, stress, hot flushes and night sweats. All right. Oh, right. Sorry, you've got to go. Yeah, I mean, if you want to put any questions, I can always have a look later. If you want to put any questions in the chat, if anybody's got to go. Right. So, yeah, sorry, Sarah.
Yeah, just saying thank you. I'll keep an eye on the chat, and then I can.
Yes.
Oh, I'm repeating. I can read them out to you if you need to.
Yeah, do you want to read them out to me then?
Okay.
Oh, so what have we got?
So I've got one here. I had a hysterectomy at the young age of 31 last year and struggling with all the symptoms and finding it hard to get support. How do you know if you're on the right amount of HRT?
Right, well, I think it's if your symptoms are controlled, really. So having a hysterectomy is having your womb removed. So some people have their ovaries removed as well. So if you have your ovaries removed as well, then you do go straight into the menopause. If you just have your womb removed, then it's thought that people go through the menopause a little bit earlier than average, maybe about 4 years earlier than average. Really, it's based on symptoms. So you can't, if you're on oral HRT, you can't do a test